The question of whether to retain the foreskin or undergo circumcision is one that men have grappled with for centuries, deeply intertwined with cultural traditions, religious practices, and ongoing medical discourse. Today, amidst unprecedented access to scientific research, the conversation often shifts away from purely traditional reasons towards a more nuanced consideration of health outcomes, bodily function, and individual preference. So, what is the definitive answer? The reality is that there isn't a single universal solution that fits every individual. The purpose of this information isn't to dictate what's right for you personally, but rather to provide clear, evidence-based facts so you can make a well-informed decision based on your own circumstances and values. We aim to cut through the surrounding noise and present a balanced view, exploring the natural biological role of the foreskin, the documented advantages associated with its surgical removal, the potential drawbacks and risks involved in the procedure, and specific medical situations where circumcision might transition from being an elective choice to a necessary intervention. By examining all these aspects, you should gain a much clearer understanding to help navigate this personal decision. Let's begin with the fundamentals. What exactly constitutes the foreskin, and what functions does it serve? Medically termed the prepuce, the foreskin is the retractable fold of skin that naturally covers the head of the penis, known as the glans. At birth, this skin is typically fused to the glans. Over time, usually by adolescence, it naturally separates and becomes fully retractable. However, it's far more than just a simple flap of skin. It fulfills several important biological roles. Its primary function is protection. Acting as a natural sheath, the foreskin shields the highly sensitive glans from constant friction against clothing and minimizes exposure to environmental bacteria or irritants. Think of it as an innate protective barrier designed for one of the body's most delicate regions. Secondly, the foreskin contributes significantly to moisture and lubrication. The inner mucosal surface helps maintain a moist, chemically balanced microenvironment around the glans. This inherent lubrication is crucial for comfort during sexual activity, reducing friction. Finally, and perhaps most significantly for many, is its role in sensation. The foreskin is densely packed with specialized nerve endings, making it an incredibly sensitive structure. It contains thousands of fine touch receptors, highly responsive to stimulation. And for numerous men, it plays an integral and often central part in sexual pleasure and arousal. For millennia, the surgical removal of the foreskin, known as circumcision, has been practiced predominantly for cultural and religious reasons. In contemporary times, however, many individuals approach this decision from a health-oriented perspective. Therefore, it's essential to examine the other side of the coin. What are the scientifically documented medical benefits associated with foreskin removal? Foremost among these is enhanced hygiene. A circumcised penis, with its permanently exposed glans, is generally simpler and more straightforward to clean thoroughly. This significantly reduces the potential buildup of smegma, a natural, thick, whitish substance composed of shed skin cells and oily secretions. While smegma itself is harmless and easily washed away, inadequate hygiene can lead to its accumulation, potentially causing unpleasant odors and creating a favorable environment for bacterial growth, which can result in inflammation and infections like balanitis.
This leads directly to the second major advantage, a reduced risk of certain infections. The warm, moist space beneath the foreskin can trap bacteria and other pathogens, elevating the risk for conditions such as balanoposthitis, which involves inflammation of both the glans and the inner foreskin. Research also indicates that circumcision performed in infancy can substantially lower the risk of developing urinary tract infections, UTIs, particularly during the vulnerable first year of life. The third, and perhaps most robustly supported by large-scale scientific studies, is the reduced risk of acquiring specific sexually transmitted infections. The evidence here is particularly compelling. Several major, rigorous randomized controlled trials, including landmark studies published in prestigious journals like the Lancet, were conducted in regions of Africa with high STI prevalence. Their findings were consistent and clear. Male circumcision demonstrated a significant reduction of up to 60% in the risk of acquiring HIV through heterosexual intercourse. The research extended further, showing substantial decreases in the transmission of human papillomavirus, HPV, which is responsible for genital warts and is a major causative agent for cervical cancer in women, as well as penile and certain throat cancers in men. Furthermore, these studies documented a notable decline in the risk of acquiring herpes simplex virus type 2, HSV2, the virus causing genital herpes. Scientists believe this protective effect stems from the unique properties of the inner foreskin tissue, which is relatively thin, non-keratinized, lacking a thick outer layer, and rich in immune cells known as Langerhans cells, precisely the type of cells that HIV and other viruses target as entry points into the body. Removing this vulnerable tissue effectively eliminates a primary gateway for infection. It is absolutely critical to understand, however, that circumcision reduces the risk. It does not eliminate it entirely. It is categorically not a vaccine nor a substitute for fundamental safe sex practices. Consistent and correct condom use remains the most effective method for preventing STI transmission. Finally, circumcision is associated with a lower lifetime risk of developing penile cancer. While this cancer is rare in developed nations, its known risk factors are closely linked to chronic inflammation, persistent poor hygiene, and HPV infection. Since circumcision improves hygiene and lowers HPV rates, it consequently correlates with a decreased incidence of this particular cancer. Of course, like any medical intervention, this isn't a one-sided story with only benefits. No surgical procedure is devoid of potential downsides. So, what are the recognized risks and disadvantages associated with circumcision? The most apparent is that it constitutes surgery, and like any operation, it carries inherent risks, even though these are generally low when performed by a skilled professional in a sterile setting. These risks encompass pain, both during the procedure itself and throughout the immediate healing period. Bleeding and infection at the surgical site are also potential complications. Occasionally, there might be an unsatisfactory cosmetic outcome, such as noticeable scarring, uneven skin removal, or the excision of either too much or too little skin, potentially necessitating corrective surgery later. The most frequently discussed and debated disadvantage revolves on the potential for altered sensation. As previously emphasized, the foreskin is richly endowed with nerve endings contributing significantly to sexual pleasure. Removing this tissue inevitably changes the sensory landscape of the penis. The glans, now permanently exposed, undergoes a process called keratinization over time. The skin develops a slightly thicker, tougher outer layer as an adaptation to constant contact with clothing, which generally results in reduced sensitivity compared to a covered glans.
While the vast majority of circumcised men report fulfilling and satisfying sex lives without perceiving any negative impact, some individuals do report a noticeable change or reduction in sensitivity that they feel diminishes their sexual experience. This remains a highly subjective and personal area, but it is undoubtedly a valid consideration for many. Finally, removal of the foreskin means permanently losing its natural protective and lubricating functions. The glans will be continuously exposed to environmental friction, leading to the keratinization process mentioned above. And while we are addressing sensitive topics concerning sexual health and performance, it's pertinent to acknowledge that for many men, concerns extend well beyond the foreskin itself, often focusing on the fundamental challenge of achieving and maintaining strong, reliable erections. If this is an area of consideration for you, there's noteworthy information available. I recently encountered a fascinating video created by a leading biomedical engineer detailing an unconventional yet remarkably simple 7-second home technique. This approach targets the underlying physiological root causes of male performance issues naturally, without reliance on pills or invasive injections. For those interested in exploring this further, it's easily accessible. Simply scan the QR code displayed on screen with your phone's camera. I've also placed a direct link in the pinned comment below this video. It presents genuinely insightful perspectives. Returning now to our primary discussion, let's address the specific medical scenarios where circumcision shifts from being an elective choice to a clear medical necessity. After carefully weighing all these potential benefits and drawbacks, how does one ultimately decide? When does surgery become the unequivocally right path? The answer hinges entirely on individual circumstances. There are specific conditions where circumcision is not merely an option, but a strongly recommended medical intervention. The most prevalent of these is phimosis. This condition occurs when the foreskin is excessively tight and cannot be retracted back over the glands. While mild cases might be manageable with topical treatments or gentle stretching, severe phimosis can render proper hygiene impossible, lead to recurrent painful infections, and cause significant discomfort or even tearing during erections or intercourse. A related but far more urgent condition is paraphimosis. This constitutes a genuine medical emergency where a tight foreskin is retracted behind the glands and becomes trapped there, unable to be returned to its normal forward position. This acts like a constricting tourniquet, severely impeding blood flow to the glands. Paraphimosis demands immediate medical attention to prevent potentially serious tissue damage or even necrosis. Additionally, for men experiencing chronic, recurring infections like balanostitis that prove stubbornly resistant to treatments such as antifungal or antibiotic creams and rigorous hygiene measures, circumcision often serves as the definitive curative solution. For individuals not facing these specific medical issues, the decision becomes profoundly more personal. For parents contemplating circumcision for a newborn, the choice is frequently rooted in cultural heritage, religious beliefs, or preventative health considerations based on the evidence. For an adult male without existing medical problems related to the foreskin, the decision typically involves a personal calculus, weighing the potential long-term health benefits against the inherent surgical risks, the permanence of the change, and personal preferences regarding appearance and sensation. In conclusion, the foreskin demonstrably serves natural and useful biological functions related to protection, moisture, and sensation. Conversely, its removal offers significant scientifically validated health advantages, particularly concerning hygiene, reduced susceptibility to certain infections, including HIV, HPV, and HSV2, and a lower risk of penile cancer. However, circumcision is undeniably a surgical procedure carrying inherent risks like pain, bleeding, infection, and the possibility of cosmetic issues, and it permanently alters the anatomy and sensory experience of the penis. There is no simple, universal answer that applies to everyone. It represents a complex and highly personal choice that warrants a full understanding of both the potential benefits and the drawbacks. If you are experiencing any pain, persistent discomfort, difficulty with foreskin retraction, or have any other concerns about your foreskin, the single most crucial step is to consult a healthcare provider. A urologist can conduct a thorough physical examination, assess your specific anatomy and situation, and offer personalized, professional medical advice tailored to your body and overall health. This is a conversation that needs to happen with a qualified medical professional, not one resolved through online forums or anecdotal accounts. We trust this balanced overview has been helpful in clarifying the multifaceted debate surrounding circumcision. If you found this information valuable, please consider giving the video a thumbs up, subscribing for more clear and factual health content, and sharing it with others who might be grappling with these same important questions. Thank you for your time and attention.